Well, hello and welcome to another version of our AOPP Thursday Live. Again, welcome. I'm Dr. Jerry Dreessen. I am the Executive Director here at the Association of PEMF Professionals. If you're watching for the first time, our group is all about teaching PEMF best practices on the human side, on animal side. We have certification courses, so if you want to learn more about how to use PEMF, if you're just not using it on yourself and you want to go out and create a business or learn more about things that you can do on yourself or on your family and friends, this is kind of what we're all about. And we like to give you free content, so it gives you a chance to learn a little bit more about this. Or if you're just wanting to find out more about PEMF in general, pulsed electromagnetic field therapy, and how people are using it. So in a nutshell, that's who we are and what we do. And if you have a chance, we're live currently. So if you want to drop in and do a quick shout out and say hi, I see Rob's jumping in there. So he's saying hi from our YouTube channel. Hey, Rob, welcome. Thanks for jumping on board all the way from Alberta. And our whole goal today is to give you some more stuff about PEMF. So with that, let's get started. And I will shrink myself down a little bit. There we go. Actually, I'm going to go over to this side. There we go. So let's talk about clinical and veterinary applications of PEMF therapy. And our whole goal today is to walk through the different sides of human and vet stuff going on. Melissa, hello. Hey, you made it. Good job. Welcome to the live. And some applications on what's going on. And what I did is I went through and kind of broke it down into, or actually our group did, the members of the AOPP. We put together kind of what the next 4 lives are going to be about. So this is going to be our part 1 of hopefully a part 4 series. And this is all about safety and side effects. So there are some things you need to know if you're going to use a PEMF device and just, have somebody come in your house and say, hey, I want to try this on you. There's certain things you need to know. And again, that's what our certification programs are all about, are teaching these things. So by the time you go through, one of them is just on PEMF in general, but one is humans and animals, small animals, large animals, and we also have an infrared certification course. So it teaches you all about what it is that you're doing, how to apply it, the good, the bad, how to build your business around it too. So safety and side effects. I broke this down into 2 categories, humans and animals. And what I want to do is start with humans first. So the common side effects that happen on humans when using PEMF. And there are a few things. One is a mild discomfort or tingling, and some users reported tingling sensation or mild discomfort at the application site during treatment. When I use PEMF devices on my patients, and I've got it's set up, mine has a dial, so I can actually dial from very low to full power on the attachment on the person. And so I'll start turning it up and we can hear it click. And based on the person, they're like, that, no, turn that down. That's like way too much. And it could just barely be on. So they're very sensitive to it. So in my world, I will bring it up to sensitivity and then back it down. Some people, they don't feel any kind of irritation at all. And they just say, crank it up, doc. And if it's their first time, it's like, no, I don't want to do that yet, because there's going to be such a huge detox. But literally their muscles are jumping, their shoulders are bouncing, or whatever area I've got it over with. So the goal, of course, is to make their first exposure or multiples appealing. So you don't want to put them in a discomforting, even though some people think no pain, no gain. Well, great thing about PEMF is you don't have to take them to that level. They're getting great benefit, and it should be soothing, which is kind of what the next thing is on a side effect is fatigue or drowsiness, and it can influence the nervous system, potentially causing temporary fatigue or relaxation. And I say fatigue in a good way. It's not malaise fatigue where like, oh my God, I feel like I'm going to just pass out. I have people using the device and I'll come back to them and they have it on their back and they're just they have their eyes closed and they're relaxing and they drift off. Some people are like, man, that's, I haven't felt that relaxed in a long time. So side effects in this course is a good thing for some people because they finally are able to sit and relax without back pain using the PEMF. So sometimes those are things you look for. And then, of course, in rare occasions, people get headaches. But again, this is the detoxification. So just remember, this system awakens the detoxification. So any medications people are taking or, even things that have been in their system for a long time, we have them list all their medications. And past medications is another good one to have them list because even though they've stopped taking a certain prescription medication, it can stay inside their body. It can be inside their fat cells. It could be in their tissues. It could be in their organs. And PEMF can actually move this stuff out so that it can be eliminated, but it has to go through the blood system again. So just be careful. And that's why we have people drink water before and after to make sure that they're hydrated. Because if they're not hydrated, you have PEMF on them, you have it turned up just below discomfort, and you see their muscles contract and things like that, they may go through a detoxification. So, and they need to know that ahead of time too. So that way they're partnering with you on potential side effects. So it's like, oh yeah, you told me I might get a headache and, I kind of lied to you. I wanted it to go up a little bit higher. I thought I was going to get better. I could get more for my, more bang for the buck kind of a thing. But I did what you recommended and I drink a lot of water and I'm fine. So that, that's the outcome that you want on that. Some less common side effects that can happen. There could be increased pain or inflammation, and in some cases, particularly with overuse or high intensity settings, a little bit what we were talking about, they may temporarily exacerbate pain or inflammation before the improvement occurs, known as a healing crisis. So if they have like a deep wound, you're in there and you're moving stuff around. Just the same thing like a bruise or, any kind of tissue manipulation where there's already high sensitivity to pain going on. PEMF is going to trigger those things too. We have pain fibers. We have nerve fibers that have like an attachment on the end of it. So this might be an attachment for pressure or an attachment for proprioception. A pain fiber is just a nerve fiber with nothing on the end of it. It's called the class C fiber. And when you get injured, that it's kind of like a split end on your hair. It's like it'll branch into 3 or 4 other fibers. So now there's more pain fiber for the same amount of pressure, and it's our body's way of protecting us. And as the place heals, then those fibers, recalibrate down into one fiber, and then eventually the pain is gone. So pain is a good thing. It helps us protect the area, but when you put PEMF over that area, you can stimulate those pain fibers. Nausea or dizziness, again, it's rare. Especially in sensitive individuals with prolonged exposure. So when you first put a device on somebody, they go, whoa, I can really feel that. And you've got it set on low. Then that's somebody that you can put a towel in between the device and the person to kind of gap, I call it an air gap between them and the device so they get less of it. And then it's a less time to start out with and make sure they're drinking a lot of water. So that's how you can work towards that. And again, skin irritation. So prolonged contact with PEMF devices may cause minor skin irritation in some users. Sometimes it's, the PEMF device, what the wrapper is on it. They may have some sort of contact dermatitis with it. They may have, some people are actually allergic to their own sweat. So like if they wear, sweat bands, they'll have irritation there. So just be careful of that. And again, a dry cotton towel gap far as the contact, then that should take care of that too. Those are all things that you can put inside your toolkit. So as far as contraindications and precautions, things to look for, and again, these are all things we talk about in our certification courses too. Pregnancy. PEMF is generally not recommended for pregnant women due to limited research on fetal safety. I've used it on people with shoulders and knees and ankle problems. Just keep it away from, low back and stomach area where the baby is. And so we have no idea, what's going on there. In theory, it should not be a problem at all. But nobody wants to experiment on babies to see what happens after, 6 weeks of PEMF on a fetal while it's growing. So just when in doubt, just don't do it. So that way, if there's ever a complication, if that person has a complication with the pregnancy, they're going to think back, okay, what did I do different? And if PEMF was one of those things, they're going to ask you about it. So if you're not prepared for that and you don't want to be part of their equation if things go wrong, then just say, there's not enough research on pregnancy and PEMF, so I would rather not do it until after the baby is born. Implanted devices. Again, we talk about, there's pacemakers, there's insulin devices, there's, TENS units. Those things all have little microchips and, powered a microchip system. And that's what usually gets the nanopulse can get in there and disrupt that. So, and hearing aids too. So if they can remove hearing aids, you're good. Any device they have on, if it's removable, you're fine. But if it's implanted, then you run the risk of turning that device off. So sometimes you just have to say no. It's like, I would really love to have this technology on you, but there's a chance we might shut off that device, and that's not what you want. Epilepsy or seizures. PEMF may lower the seizure threshold in some cases, so caution is advised. And again, that could be just due to a detoxing event. Epilepsy is it's a very interesting event in how the brain chemistry can also trigger an event. So knowing those things ahead of time definitely helps out. If they're on anti-epileptic medication, again, PEMF will help deliver the medication more. So their blood absorbs that medication even more. So those are the other conversations to have is like, well, what medications are you taking? Because PEMF can allow your tissue and your blood system to absorb that medication even more. So those are some precautions there. Active bleeding or cancer. PEMF should be avoided in case of active bleeding or certain cancers, as it may promote blood flow or cell growth. So buyer beware. If you're using this on people and you're not going through our questionnaire and you don't know what's going on, and as a result of it, things happen. That's why we really recommend getting certified and going through these steps and things that we teach. Children, use in children requires medical supervision due to limited data. Again, bumps and bruises, sore muscles. I have no problem using it on my kids because I know my kids. Using it on somebody else's kids, we don't know. And that's always what it is. It's the unknown. And so if the child has some sort of a response that they would have had, regardless of PEMF, the parent's going to go, why did that happen to my kid? Well, let's see. Let me go back in history. Okay, there were these things, and one of them was PEMF. Then they ask you about it. So use it under your own cautionary systems. I find that the very lowest dose PEMF units and the very lowest, as far as lowest power, lowest time, are very soothing. And again, in theory, we can all benefit from this product if it's done correctly. So the question is, what is correct? And so those are great topics of exploration. And we cover that through our certification courses too. Okay, now let's jump in and talk about animals. And again, humans and animals pretty much similar things going on, but the animal can't talk to you, or we don't have the ability to understand what they're saying or read them. Some of you have that ability. Your horse whisperers, your dog whisperers, your animal whisperers, so you can kind of see it in their face and their eyes. I just watched a documentary about a guy who's looking at the language of dogs, and you guys tell me, but apparently when the tail's wagging and the butt's wagging, not only are they happy to see you, but if it goes over, the tail goes to the right, then they are very accepting and happy to know you and that you're their friend. I don't know if that's true, but that's what this one guy's like in his experiments. That's what he's seeing. So drop it in the comments. Let me know about that. So let's talk about animals. PEMF is increasingly used in veterinary medicine for conditions like arthritis, wound healing, post-surgical recovery in animals such as dogs, cats, and horses. And I've seen it. And owners talk about like shepherding dogs. It puts the pup back in the dog. They're bounding around. They're happy. They're running. Great for arthritic hips. You guys know that. Our cat, when we're using it at home, will jump up on our lap and get close to the circle. She's got a bad shoulder and she just curls right up next to it. So they come to it. We don't have to put it on them and say, sit or stay while you put it on there. They're like, at first, like, what is this? And then they start to feel it. So anybody that's ever used PEMF on an animal knows what I'm talking about. However, there are some side effects that we just need to cover real quick. Again, mild discomfort. Some animals may show restlessness or mild discomfort during an initial session, probably due to the unfamiliar sensations or the sound, or that it's just too strong for them. And I usually, like to start out on a very light setting for an animal so they get used to it, or that they're near it. Some of us, we'll cover it with blankets and they lay down on the blanket. Those of you that are working with grizzly bears or tigers, it was very interesting. I've seen giraffes, but it goes up against the side of the cage and they'll come lay up against it. So again, they have this intuition and they know that it's good for them, and they become part of that. But similar to humans, they may appear more relaxed. Local irritation, prolonged device contact may cause skin irritation in sensitive animals. So those of you that work with animals, you probably have your list of timing and placement and distance and all of those things that you develop over time. If you have that wisdom and knowledge, feel free to drop it in on our YouTube and Facebook on jumping in and just dropping in a quick note. That'd be great if you have that information. Again, contraindications, you'll see some crossover with humans and animals, but again, pregnancy, be careful. Some of you may have used it like on a goat, or where there's a difficult pregnancy going on, and it helps with that. So again, drop that in the comment section and let us know. If there's any animals that have implanted electronic devices, some have pacemakers, just make sure. Know before you go, know before you use, talk to the owner, if it's your animal. And again, cancer, PEMF may stimulate cell growth, depends on the type of cancer, but it's contraindicated with known malignancies unless under a veterinary guidance, or if you know what's going on. We've seen tumors shrink on animals, so it depends on the type of tumor that's going on and what it's all about. If it's got a huge blood feed to it, if it's tapped into the system or not. So there's a lot of not experiments, but lots of things going on where this is being looked at, and we're going to be seeing it more and more publications being done with people doing this and finding out what's going on. And again, in some cases, PEMF may worsen acute inflammation if applied too soon after an injury. So, it's like, how soon can we use this? These are all precautionary systems. I've had a guy come in right after his tooth got pulled His jaw was swollen. We put it, it was like within hours. He came in, we put it on. It stopped the bleeding, and the swelling went down dramatically. So, I've seen it go just the opposite of this, but we want you to play the safe side. So always take the safe side, unless it's you, if you're putting it on. But it's you crossing this line that we're putting out here for you. So, and use us as your line, saying, well, according to the AOPP, I'm not going to put this on your wound until you've had 3 or 4 days of it to heal, that kind of a thing. So, definitely use this as your anchor to say no. And then species-specific consideration with animals. So horses commonly used for the equine musculoskeletal issues. Horses may show temporary soreness if it's applied at high intensity. And you know that. And we talk about that in our large animal certification course. And then the small animals, dogs and cats, they're more sensitive to PEMF, requiring lower settings and shorter sessions to avoid overstimulation. And I've seen just the whole thing about PEMF and how it, like I said, puts the pup back in the puppy, on hips, especially hip dysplasia or arthritis. I've seen it on animals and humans, and that's why I'm here. That's why I'm talking about this. It's such a powerful product that's all natural and what it can do. So with that, I will wrap this up here. We talked about clinical and veterinary applications of PEMF therapy. And those of you that are watching live, I appreciate that. If you're watching the recording or watching it live, the things that you can do to help us out, just spread the word, who we are, what we're about. There are more and more devices that are being manufactured out there. More and more people are buying them. They're wondering, okay, I've got this PEMF. I saw a video on it. Now what? Where do I get a machine? How do I use it? And that's why we are here to help people with that. So, like, and share. Share our YouTube page, like that. Subscribe to the channel. Same thing with LinkedIn and Facebook. Subscribe, like, and share. Grab our content. Grab the link and drop it in your Facebook page, or shoot an email out to your group, your 4-H club or your equine or dog group, and let them know that this is out there to help them out. And again, our members only group, drop in there, ask us questions in there if you want to stay inside the boundaries of the AOPP and not be so public on what you're talking about. That's what we're there for, is to have more of a private conversation in there, and always happy to reach out to you there. Some of you are members and you've said, hey, I'd like to join the group, and we try and go through there on a weekly basis. I know there's a few in there we have to approve. So hold on, we'll jump in there and get you approved in there too. As long as you are a member of the AOPP. And of course, if you want to know who we are, what we're about, on our website, we have our code of ethics, what we're all about, and everything PEMF is what we're all about. But full transparency, we want to let you know what's going on and teach you what's going on so that you are fully aware of this wonderful device that you're using. If you have any questions about it, info@PEMFprofessionals.com. Become a member. It's pretty easy. And, PEMF Professionals, and check out what our membership is all about. If you have a group of people or a business, you can join as that business as well, and bring everybody on board with that. And hey, Rob, yeah, thanks. Happy Easter to you as well. Hope you find all of the eggs in Alberta. Okay, maybe not all. Well, I don't know. I mean, that's, well, it was a fortune with eggs, unless you're like my grandparents and had the plastic ones full of $10 bills, right? All right. So with that, thank you so much for your time today and watching this live or on the repeat. So with that, I will see you next week, and we'll jump into part 2 of our series. And thank you so much, and have a great day.